Panic attacks would be, some people will just get a very occasional panic attack in their life, and we might describe those now in a minute. The panic disorder is the one that really people would generally be sent to me for some help. And panic disorder would be where a person is getting repeated panic attacks, where their whole life is being consumed about where is it going to happen next. Is it going to happen in a shopping centre? Is it going to happen in the middle of a crowd? Will I be totally embarrassed in a situation? Will it happen at home when there's nobody around and I will be totally afraid of what might happen? So panic disorder is a tremendously debilitating condition, and it eventually stops people sometimes leaving their houses or going to shopping centres or churches or theatres, etc., because they're terrified that something like this is going to happen to them. And the tragedy of panic disorder is that I've seen people who may have suffered from this up to 20 years, and yet it's absolutely amazing how a very small amount of CBT type approaches can absolutely revolutionise how they view these. And I would often clear these away for a person in maybe a couple of sessions. That's the tragedy, that it's such a simple disorder and yet so many people are suffering from it and not getting maybe the appropriate help.
So, yeah, what you're saying is it's actually so very treatable.
Totally treatable. This is one of the simplest, most easily treatable conditions probably in the whole of the area of mental health. The secret to panic attacks is to learn one crucial piece of information: that symptoms of anxiety are uncomfortable but not dangerous.
That's a great saying, and you get people to write that down, don't you?
I do. I get people to write this down. That becomes their Bible, that line.
Brilliant.
So when they go in, they're prepared for the discomfort. They accept now they're not dangerous, but they're uncomfortable. And once they learn to accept, hey, this is uncomfortable, but why am I allowing something that's just uncomfortable take over my life? Yeah. So they begin to realise, hey, this is just a nuisance, do you know what I mean, like an unwelcome friend. So they begin to normalise these symptoms. And the second you normalise the symptoms of anxiety, you've won the battle. The battle is over, And the great thing about this information is that once you put this into practice, panic attacks will disappear out of your life, not just for a short time, but forever. And that's the really important message. If you turn and face your enemy properly once, it never will be an enemy again. And that's the tragedy of panic attacks, that people spend their lives on the run from panic attacks. Instead of learning a little bit about your enemy, understanding it, dealing with it, and getting rid of it out of your life for good. Yeah. And that's that. And I must say, my success rate in doing this is enormously high, because in fact people are immensely have great resilience skills. They just don't tap into them. And people are more than capable of handling these uncomfortable feelings. They just have to learn what they are, get a bit of knowledge about them, how to do it, and move on.
Well, I don't think they get the right information, and they're not as fortunate to go to a doctor like you who'd be as aware of the nature of anxiety and panic attacks.
Yeah, I think one of the things that worries me the most is that we should not be treating panic attacks with drug therapy. There is no place, in my opinion, for using drugs. If a person is very depressed, then I would be totally in agreement with a person using medication as part of a package, for example, which I would recommend all the time, involving lifestyle changes, CBT and drug therapy for a person with depression, and that's very effective as well. But when it comes to simple panic attacks, there is absolutely no need to be taking tablets, or another thing that people try to do is they try to do all kinds of breathing exercises. They're told to breathe into brown paper bags or do all kinds of distraction breathing techniques. In fact, the more I do of those things in the middle of a panic attack, the more anxious I'm going to get. And the reason for that is because it's like as if I'm saying to my body, well, this is so dangerous that I have to do all these things to make it go away. And of course, the more I do that, the more anxious I get, and the more anxious I get,
the more you resist it.
Yeah. It's that if you could just kind of accept that you were stuck to the ground, and that this was simply a normal burst of adrenaline, that if I did absolutely nothing, that in 10 minutes it'd be gone, and began to realize, hey, this is a nuisance, it's a pain in the neck. But if I accept that it's like this, then it just begins to settle down. And of course, the real secret of this is you must put it into practice. So I would tell people, I want you as quickly as you can to get into the nearest shopping centre you can find, because I want you to bring one of these on so you can put this into practice.
Yeah.
And of course, they go out to try to do this, and they're trying to bring it on, and they can't, because they've now understood that there isn't a danger. And once there's no danger, the panic attack goes away.
Yeah, I really like that idea of being stuck to the ground, because the problem is when people leave the situation,
exactly,
and then they fear it, they avoid it.
Yes, the more you try to run away from a panic attack, the more it will run after you. The minute you turn and face the panic attack, and that idea of being stuck to the ground means that if I could visualize that in my head, what would actually happen? In reality, because it's my stress system that's firing, and we have already said that your stress system is definitely there to keep you alive, not to kill you. Well, all that's happening, my stress system is firing. That will settle down after 10 minutes. So why am I running away? So, it's kind of trying to maybe go with the panic attack, go towards the symptoms. I usually tell the people, imagine that you were putting your arms around them and embracing them, and that they're very uncomfortable, do you know what I mean?
Yeah.
But if I could learn to deal with discomfort, and one of the big things that I teach people is that we all run away from discomfort. None of us in life like discomfort. So our first thing to do, oh my goodness, if it's uncomfortable, I'll do a runner. And sometimes in life, if one of my great statements is, sometimes we need to look at short-term pain versus long-term gain. For example, if I'm in the middle of a shopping centre, if I run away, I get rid of my short-term discomfort, okay? But I have the long-term pain of having to live with panic attacks all my life and being afraid to go anywhere. On the other hand, if I accept short-term discomfort, in the short term, just embrace and accept these symptoms as uncomfortable and don't do the runner, then what happens, of course, I get the long-term gain of not having to worry about panic attacks the rest of my life. So I usually say to the person, well, if Dave might say to me, but it might be very uncomfortable if I did this, and I would say, yeah, well, is it comfortable having panic attacks for the rest of your life? Or would you like to get rid of them? And it's amazing when people accept that discomfort, how quickly they deal with the matter. And it's all over.
Yeah, I love to hear you say that, because what I write in the book is get comfortable in your anxious discomfort.
Exactly. Yeah. Just be comfortable with your discomfort. Do you know what I mean? Or that wonderful lines I keep saying is that symptoms of anxiety are uncomfortable, but they're not dangerous. So once I stop assigning a danger to these uncomfortable symptoms, accept them as uncomfortable. But if I go with them and learn to absorb them and accept them, in the short term, very quickly I'll get the long-term gain of getting rid of my panic attacks altogether for life. And that to me is the goal. Should be not just that you get rid of them for the next couple of weeks, but they should be disappearing out of your life for good, long term. And it's once you have this clear understanding that all that's happening, your stress system has been inadvertently fired, and your job of your stress system is not to kill you, but to keep you alive, keep you safe. So why am I kind of running away from something that actually his job it is to keep me safe and alive?
Yeah, that's perfect. And I think people would really appreciate hearing this coming from a doctor. The reassurance, the normalization of the anxiety and the panic, and the way you've talked about diffusing it. I think it's a really great message, and thank you for sharing it.
Not at all. It's an absolute pleasure, and my wish is to all the people who are listening to this is please put this into practice. Don't spend all your life running from something which actually has no power whatsoever, but we're giving it wings, we're giving it power itself. So, embrace this, deal with it, and get panic attacks out of your life.
Because it's so very treatable.
Yeah, absolutely treatable.
Thank you very much for your time, Dr. Barry.
Yeah, not at all.